Now remember, you don't just have to see Mr. MD. You can see Mr. ND, too. Welcome back. You're listening to the Dr. Health radio program. And David Snow is off learning new information for you to share next week. And remember, this program will re-air tonight at 9 p.m. So if you miss anything, give it a listen. And right now we're talking to Kira. I don't know how to say her, Anthofer or Anthofer or...
You do such a great job. It's Anthofer. That TH is kind of a soft T.
Yeah, okay. Well, welcome back, Kira. You are a senior living advisor, and I mentioned before the break that sort of a medical model versus a social model, I imagine, makes all the difference in the world. If you're focused on disease in a residence, then it's all going to be about, sort of pain and suffering, versus a social model. Well, I'll let you explain.
Sure, thank you. There are several things that are different between a social model and a medical model. And in a medical model, one would need to have a medical need, like maybe recovering from a surgery, or they may have a health condition that would require continuous skilled professional supervision, such as a continuous nurse or a doctor to look at their condition, versus a social model. Somebody could live in a social environment where they might need some assistance with care, but minor care, like needing assistance with bathing or dressing or even medication management. They may have some minor medical needs, but a visiting nurse can take care of that. Monetarily, a social model is a lot less expensive than a medical model. A medical model is very hospital-like. It could average $6,000 to $8,000 a month out-of-pocket expense in a medical environment, versus social that can be maybe $3,000 or $4,000 a month.
When an individual is trying to make a decision as to where to send their loved one, can they work with somebody? Are you available? Can people? I mean, how can we access your wisdom? Have you written books? How does? Because I would think it would be so valuable. I mean, I learned by trial and error, and fortunately, I had some medical background, so that helped me a lot. But for the average person, I imagine it's pretty daunting.
It is, and I have the great fortune of actually having 10 years of experience of running and operating, assisted living dementia programs, and they can go to my website. My title is a senior living advisor. People can look up local senior living advisors as well in their area. Just Google that. But I also have my website, SentinellaSeniorSolutions.com. And I've also produced a YouTube channel where on a weekly basis I have a 2-3 minute video where there's a home-like activity one can do with their senior, something a little bit different than just bathing and giving medications, but something a little bit more interactive.
Wow, terrific. So, Centella, can you spell that for our listeners?
Absolutely. It's Sentinella. It's CENTINELA, Senior Solutions with an S at the end. And Sentinella means a guardian. I feel like I'm a guardian for seniors in our area.
Yeah, with one L. Sentinella. Yes. Okay, Sentinella Senior Solutions, S. Okay, terrific. And as you said, you could probably, and I think it'd be great for people to get access to your YouTube site as well. So maybe you could probably just Google your name. I'm going to spell it for everybody. It's Kira, Kira Anthofer, Anthofer. Maybe if you just Googled your name and senior, I don't know, what would be a senior care advisor or assisted living consultant?
Senior living advisor.
Senior living advisor, thank you. Okay, yeah, there it is right there. So I don't know if you want to talk about what happened in the news recently, that 911 call. What's your take on that?
Yeah, I spoke on our local news station about that as well. There are, it was a call that was really unfortunate in how it was handled. Now that after a couple of weeks of what has been heard, I've talked to several assisted living communities, and some of them do have in their admissions agreement that they do not perform CPR.
Mm-hmm.
There's nowhere in, at least in the state of California, of any regulations to state that a staff member has to know CPR. But there are some communities where they do train, and they do encourage people to practice that in the event there is an incident. However, big comma mark, many elderly are asked and look at doing a do not resuscitate form.
Right.
So that's very imperative. Usually the staff know who has and who does not have a do not resuscitate form.
Mm-hmm.
So I know now that a lot of administrators are being asked to talk about that form right now.
Now, isn't that something that's typically done right at the get-go? I mean, I would think that would be part of your admissions package, if you would.
Usually it is, but some people still decide not to do that. But I believe it should be practiced where every 6 months or so, if there's when there's a change in condition of the senior, to have that discussion again.
Yeah, yeah. And, you know, this gets back to, well, first of all, the individual that made the news the other day, she did not have a do not resuscitate.
That's correct.
Yeah, so in that situation, you know, they should have done everything they can.
They truly should have. And the person should have done some sort of chest compressions. There's something that she could have done if she was truly a skilled professional, as she was saying she was a nurse.
You know, that kind of astounded me because I can't imagine not, you know, just standing there and not doing CPR. Unless you knew that person had a do not resuscitate.
You know, I have seen incidences where CPR is done on an elderly person, much older, 92 years old, and sometimes I have to say there's even more damage on that 92-year-old with broken ribs.
Right.
And the rehabilitation after that is quite long and lengthy. But I think in that condition, and that specific incident, I think it could have been handled better.
Yeah, yeah. I mean, obviously, there's got to be situations where. Now, you know, you mentioned when the situation, the health condition changes, and when we had this whole healthcare debate, it was all, you know, this death panel idea that we shouldn't be talking to people about end-of-life decisions, and we're like encouraging them to pass away so we save money on Medicare and such. That was all a bunch of baloney, in my opinion. We're really talking about educating people so they have an informed decision as about what sort of environment they'll be in if they have a severe stroke, if they're on a ventilator, if they're on, you know, I mean, this is realistic talk to especially get them before dementia set in too far so they can make an informed decision. And everybody's different, whether it's religion or whatever their preferences are.
I'm a huge advocate of that as well. I bring that up to my residents, and I would talk to them about that. What are your plans? Because this is another opportunity for you to be in charge of your choice.
Mm-hmm. Go ahead, Kara, please.
I was going to also state that in the state of California, when one is admitted at time of admission, there is a publication that has to be handed to that senior to let them know what are their medical rights. They have the right to choose their medical treatment. So that is encouraged at the time of admission.
Yeah, good. I'm sorry, Kara. Chaz, I'm talking. Did we do our? No, we do. I missed a break. It's too interesting, Kara. I'm sorry. We have to take a quick break. It's a brief one, and we'll be right back. We're talking to Kara Anthofer, who is a senior living advisor and the founder of Centinela Senior Solutions. We'll be right back. Welcome back. You're listening to the Dr. Health Radio program, AM 690 KHNR. If you do have a question for any of our guests, 296-5467, 296-KHNR. Welcome back. We're talking to Kara Anthofer, who is a senior living advisor. Again, her website, www.Centinela Senior Solutions. Centinela, CENTINELA, 1L, seniorsolutions.com. So, again, Kara, advice for those that obviously getting on your website, seeing what you're doing on YouTube, which is great. You can be an advocate for these individuals. You can help them walk through the right kind of care home, what's medically necessary, etc. I mean, we've got a wide variety of care homes here, and obviously the need is exploding with all us baby boomers getting to that point. We're going to have all the VA vets now, and I understand I was talking to a patient recently. He said that they're going to create a care home here on Oahu that is specifically, geared towards VA vets, which is it's great.
Yeah, there are definitely growing more of the veteran type homes. There's several here in California and one in my town here. There are going to be 10,000 people per day getting to the age of 65.
Wow.
And they say by 2030, 18% of the U.S. population is going to be over the age of 65.
We're going to be like Japan.
Exactly.
Yeah.
And there are benefits that are out there for veterans or even surviving spouses of a veteran. That people should definitely look into through the VA, it's called the aid and attendance benefit.
Good.
Yeah, so there could be some resources out there for some people.
Great call. All right, well, Kira, it's really been a pleasure having you on the show. I thank you for the work that you're doing. We all want to have our last decade or 5 years or whatever it might be as comfortable and as pleasant as possible, and to have it be in a residence, not a hospital setting. And it sounds like you're the right person to talk to and follow your guidance as a senior living advisor. Again, the website, everybody, is www.centinelasseniorsolutions.com, and that's Centinela, Centinela. Kira, thank you so much.
Thank you, Kevin.
Aloha.
Aloha.
All right. We're going to be speaking to Dr. Meir Eisenstein.